Alcohol use disorder is a pattern of drinking where you cannot control the amount of alcohol you consume, the duration of drinking. You might even continue drinking when you're very aware about the negative consequences. We are also talking about tolerance. That means you have to drink more and more amounts of alcohol to reach the same effect. And some individuals have to drink to avoid withdrawal symptoms. Now, in a more severe case, individuals can experience mood swings, sleeping disorders, restlessness, and in general changes in behavior and affect. Alcohol use disorder is a spectrum of certain disorders, and we can talk about less risky drinking behaviors to severe forms, which we would refer to as alcoholism. When professionals assess the severity of the disorder, they take several factors into consideration. One key factor would be the daily units of alcohol which the individual drinks. From our experience, it's often the family members who reach out for help because they are experiencing indirect signs of an alcohol use disorders. These signs can be behavioral changes, the way these individuals interact with the family, maybe irritability, mood swings, sleeping disorders, and also that they might neglect important activities, hobbies, or interests, which may catch the family's attention. To my experience, there are various reasons why people look for help. Men, for example, tend to come when it's already pretty late and they develop physical symptoms. They are confronted by pathological lab values at the general practitioner, for example, or if they develop pain or other somatic issues. In some other situations, individuals are very concerned about the loss of control of their behavior, and that is the motivation for a change and reaching out for help. In our residential program, we carefully assess the situation, carry out a thorough physical examination, and also psychiatric, psychotherapeutic assessment. Our main goal is to unravel underlying causes and treat them so we can initiate long-term changes in people's lives, also help them reintegrate in their professional field, and also reconnect with their loved ones. Our team of psychiatrists, psychotherapists, doctors from internal medicine and integrative medicine, also complementary therapists, these experts all work together very closely to assess the situation in its complexity and have a 360-degree view on the case. Now, the program is carried out on a very tailor-made individual level. Our clients can benefit from the best care. One of the key elements in the program is the relapse prevention. We make sure that our patients are well equipped. That means they can cope with distress and cravings. There's a big emphasis also on coaching the family and helping them in this very difficult phase when our clients leaving treatment and they have to face reality again and transfer everything what they learned into their new life. We understand how difficult it can be for our patients to return back to their home and reconnect with their social network, find activities, meaningful activities, which don't revolve around alcohol. And we continue to provide support in this very vulnerable phase of their journey. That means if the person encounters difficulties, they can always reach out to our practice, and we do our best to support them. We quite often get the question whether alcohol use disorder can be treated and how successfully. My answer is always as follows. There's always hope. There's always a potential of improving somatic and mental health and functioning. How far we go in this journey, that is very individual. But what we promise is that we do a very careful assessment, always involving the clients. They will have full transparency about their healing chances and recovery chances. Although alcohol use is very common in our society, people developing problems with alcohol use, they're quite often stigmatized. It's very important that these people understand that we have a very open-minded and accepting approach. We are here to support and listen and offer the best possible outcomes. It's very important that either the individuals themselves or their family and loved ones reach out rather earlier than later, because there's nothing to be ashamed of. Our team of experts are here to listen and help in every possible way.